Chief Minister, thanks very much for taking the time to join us. I know you're very, very busy at the moment. I just want to kick off with one of the stories we've covered today about care homes' concerns that they don't have enough masks, enough gloves to be able to protect their staff and their patients. And they're upset that the government won't help to provide that PPE. Why won't you help them?
Right, I think there's two responses to this. Again, what I've understood is that in the exercise that was done before Christmas, it was identified to everyone who didn't usually come to the health department for PPE that they did need to stock up. And what I'm not clear on is whether everybody took that message or not. But irrespective of that side, as we get more PPE in, we will obviously be all working together to make sure everybody gets what they need. But I think that was the background to it. Just to reiterate what I think I said yesterday, we received, I'm just looking at my notes, about 20,000 masks on Sunday, and we're due, I think it's another 40,000 in on Tuesday. So there are supplies coming in, and obviously once we know that their health requirements are all sorted out in terms of in the hospital, etc., we will be working as well as we can with the other care providers on the island, and I think that's also what the health minister has said.
So just to clarify, you've got 60,000 masks due in this week. Is that going to be enough, or are you ordering more continuously?
We are ordering more continuously. So, as I said, those are the comments, the orders I've just given that are either before today or imminently tomorrow. And obviously that we've also got other supplies of gowns and gloves. We're also awaiting some further supplies coming down through the NHS supply line. And also, as I alluded to yesterday, we are pursuing other avenues, which I don't want to comment on at the moment, but we are pursuing other avenues to make sure we do have enough kit coming through to get us through the entire period.
Can you just give us an idea of those avenues? Are they other supply chains?
At this stage, we're exploring every avenue we can lay our hands on, but we are obviously we get stuff through the NHS supply lines. We had and are expecting some big deliveries, literally, as I said, yesterday and tomorrow, and to my knowledge, those are likely to continue.
Notwithstanding those big deliveries, my sources inside the hospital told me there's been gross incompetence with regard to the ordering system, that a couple of weeks ago, the person in charge of ordering PPE was procrastinating over the cost. Then they went on holiday. Those purchase orders were not passed on. Is that true?
Certainly, and for your viewers, you've obviously given me advance warning on that question. And the response we've had from health is that is categorically not the case.
Was there any incompetence that contributed to this delay?
To my knowledge, on the basis of the supplies we are getting coming through, there have not been any delays. And therefore, as I said, on the basis of the response I've had from health in advance warning of your question, no.
So why were the hospital running low on stock at the end of last week?
I'm not aware that the hospital was running low on stock. I know, we've had one or two comments that have come through, and part of that has been around individuals in their particular positions, either not necessarily using PPE quite correctly, or perhaps using it when it wasn't necessarily being needed to be used. I'm not a medic, that's the information I've been provided with. I do have to say as well, I understand that there is a meeting on Thursday with all the relevant affected care providers to go through, I think, the PPE supplies, making sure everybody knows properly how to be using it, all that type of stuff. So there is, again, as I said, a further piece of work being done on Thursday just to go through all that side of things.
OK, let's move on to ventilators now. We understand that the hospital has access to 27 of them. That's what I understand you said the other day. Are you ordering more?
Yes, an order was placed. I can't remember exactly when, but it was, I think, at least 2 or 3 weeks ago. And there are at least another 10 on order.
Will that be enough?
I'm informed that is a good supply of ventilators. and should be enough. And obviously, everything is all dependent all the way through on us getting the strategy right in terms of flattening the curve at the right times to make sure that health services as a whole don't get overwhelmed. So provided that strategy works, I'm informed that that is the case.
Now, we've seen China, Italy and the UK order devices, using devices called CPAP devices, which are basically breathing equipment which bridges the gap between an oxygen mask and full ventilation. Is Jersey ordering such devices?
I'm informed we already have CCAP capacity. I can't tell you how many devices we have, but I'm informed we already have that on island.
Have you got any idea how many?
I do not know how many, but we have the capacity on island.
Okay, we'll follow up to find out some answers to that specific question. Talking about the hospital, we understand there are 10 people currently in the hospital with coronavirus. Can you tell us, without obviously revealing those people's identity, are they elderly? Are they young? Do they have any underlying health conditions?
Right. At this stage, we must always remember that behind the statistics is human beings. And one thing that health are very, very cautious around, just generally, but even now particularly, is around making sure that the identities of those individuals and any other personal information is not put out into the public domain, because it is around privacy fundamentally. So at this stage, we're not giving that level of information out. I am seeking a way to see whether we can address, for example, your queries and occasional other questions we get from within the public sphere. Is there a way we can get that information out in an appropriate form which doesn't breach their confidentiality? Got to remember that when we're at very low numbers, which is where we are at this stage, individual cases can become identifiable if you're not careful.
I completely understand that, but I think it's important for the public to know whether these people who are in serious care and obviously at the more serious end of having the virus are the sorts of people that you would expect to have the disease and have treatment in hospital, or whether actually they're more rare cases of younger people contracting the disease and therefore the public needing to be even more vigilant in their actions.
As I said, what I will seek to do is to see if there is a way to meet that requirement for extra information, shall we say. And as I said yesterday, actually, there are much larger jurisdictions that have, for example, put out later how many people have recovered, all that type of information. But at this stage, because we're dealing with so small numbers, we are keeping it in a generic form to make sure we don't identify people. But I will see what we can do on that, because I do understand the concerns. At this stage, the whole strategy remains about flattening the curve. And at this stage, as I said, the update we had yesterday was 81 cases.
You've said that you will create extra hospital capacity and that 600 beds are available elsewhere. Where exactly is elsewhere?
Again, I think we alluded that to in the press conference yesterday. So, for example, there are some private sector providers, there are some nursing homes, and also one which is pretty obvious is Overdale has extra capacity in terms of we've stopped all the non-essential operations some 2 or 3 weeks ago from memory. And so there is capacity there straight away.
And how quickly, and how quickly could that capacity be accessed and converted for the specific needs of patients?
Well, my understanding is that we have that capacity as of now, that they've been gearing up on those things. Now, whether that means any preparation's got to be finished in the next couple of days, or whether it's actively ready to go, I can't confirm now. But what we've been told is that on island capacity, in terms of beds that we might need, if we needed them, is around 600 over and above the existing capacity of the hospital. The fact that at the moment we only have 10 people requiring treatment gives an indication that we've got quite a long way to go before we need to cool down on that capacity. But as we keep saying, we're at the very early stages of the wave, for want of a better expression, and obviously this will change as the weeks progress.
Understood. What's the plan to recruit extra medical staff if needed?
One step was the arrangement we did with the GPs, which was announced last Monday, and that brings in obviously the GPs, but also quite a number of their staff into the whole system. So that was a major positive impact, and we're also bringing in some retired members of staff, and that's been activated over the last 2 or 3 weeks as well.
Are they going to be up to speed in terms of their training?
Yes, my understanding on that is that I think part of that is staff who've been only retired in I think it's the last 3 years. I'm sure I've been told that somewhere. And so yes, and if they're, depending what they're being used for, obviously their training is going to be updated. Just to clarify something, I've just had a little bit of information. We have 7 CCAP devices on island.
OK, that's useful to know. Thank you, Chief Minister. Let's talk about testing now, because you confirmed yesterday 5,000 test kits have been ordered. When are they arriving?
We were expecting them sometime in the next couple of days. I'm just waiting for a further update on that, because I think things are moving in terms of what the status of that and other avenues we've been exploring.
And why order 5,000 kits? Why not over 100,000 to test the entire population?
Oh no, the whole principle on all of this is to get what we can as soon as we can. And part of this around has been, as the technology has been produced, available through that has got to be of the relevant quality to give us confidence in the results. And so it's only very, very recently that we've been getting the kit becoming available to do the type of testing we've been talking about. And also there's a big focus between the COVID-19, in my terminology, the COVID-19 direct testing. It tells us whether you've got it at present or not, and the antibody testing, which says you've had it, and on the medical advice we've had to date, that says you're immune. The latter is the next big prize, because that means then we have been looking at significant volumes to test the whole island on a number of occasions, because that will then give us how it spreads across the island, and then give us an indication as to where we are on that curve, on that wave. We haven't yet got specific dates on that, but that's one of the things I'm waiting for an update, hopefully later today, actually.
I was going to ask you that. When are these antibody testing kits going to arrive? But how many then of those are you wanting to order?
At the end of the day, this is all about what's available in terms of when you're dealing with a supplier, rather than what we want to order. But we are talking about sufficient to do the entire population.
Well, so how many have you ordered? I mean, how many can you order? What's the maximum you've been able to order?
So, we have been talking about orders between 50,000 and 100,000. Obviously, if it's 50, you'd be seeking to do a reorder after that. So, but can I please reiterate, this is always very fast moving. There's always changes. There's always glitches that you haven't foreseen. So that's why I'm waiting for the update later today.
Yeah, and that's it, isn't it? The problem is, unless you test absolutely everybody, you can't get an accurate picture of the spread of the virus. And without an accurate picture, you can't then make informed policy about the measures you're enforcing. So once you get accurate data, is that what you're relying on in order to update your policy and, perhaps relax the lockdown a little bit? Is that what it's all about?
Okay, so there's 2 strands to that question. There's the first one in terms of what's been informing the decisions to date, and that's based on the testing as people present themselves, and how that profile fits into everybody else's experiences in terms of the models that have been put together for us, And those are the models that have come out of Public Health England, World Health Organization, using the experiences from Italy and China and elsewhere, but profiled down to match the island. But then, as you say, to know then the wider context, so that's on a, if you like, that is a sample basis, to actually try and identify the full spread across the island. My understanding is we do want the antibody kits, which therefore would have to be applicable to a much wider, a bigger quantity of the island. What I don't know is whether we actually do need to test everyone, or whether if you test a sample and you get the right results, whether you can then basically apply that across the island, because it becomes a statistical exercise. For me as a layman, and from the information I've had to date, you want to get the kind of 50,000 plus number of kits into the island, and we've had discussions around 100,000 as well. But at this stage, I'm waiting for the update before we can say definitively what's happening.
Well, that's the point, isn't it? Is that at the moment, your modelling is based on the test results you're getting back. But we know that those test results are only from people who've presented themselves with symptoms. And you mentioned, I think, yesterday that you think, although we've got 80 plus positive test results in Jersey, there may be about 800 people in the island with the virus.
Yes, that's correct. But as I said, the people who advise us on this take all that into account when they give us their recommendations as to what policy we should, at what point we need to make change decisions or change the policy we've been following in terms of going up to any next step. And so they take that into account. The example I was using, which is the kind of rule of thumb, that for every test, every case that comes to us and is presented as positive, the rule of thumb is that there are about 10 people who haven't presented who are also positive. That's based on experience from other jurisdictions. And so similarly, we're using the experience of the other jurisdictions to inform the modelling we're following, which then informs the decisions that we're taking. Okay,
so based on the data that you have at the moment, do you have a projection of when the peak of coronaviruses will be?
The timescale we've been using for everything to go through is between 12 and 16 weeks from when it started. And so if you take the midpoint of that, that would give you an indication of when the peak might be, which would be about halfway through. But the point is it depends on the impact of each strategy as to whether you bring the peak forward, because that means you sped it up, or whether you push it away because you've actually slowed it down more than you're expecting. Okay. That's kind of the indication. That's why we've been talking about the long haul of weeks, not days, in terms of lockdown and things like that.
Yeah, I know, I understand that. My maths is telling me then, if you're saying the projections look like the whole wave will go through by maximum of 16 weeks, we're looking at the peak to be in a couple of months. So we're looking at kind of middle of May, end of May for the peak.
I think from memory, so I don't have it in front of me. I think we were talking, it could be end of April, middle of May. If we slow it down, it could go to the end of May. That I would need just to refer back to my notes, which are in another room at the moment. But that gives you an indication of where we are. As I said, last time I looked at that was about 3 or 4 days ago, and but it depends again on how we match the actual results we're getting against the profiling, and then that updates where we are on the peak.
Let's try and get some positive news out of this. Do you know how many of the people who tested positive have now recovered from the virus? Do we have those figures?
Not yet. We're working on it. And one of the reasons, again, I alluded to that yesterday, one of the reasons so far is that it takes about 2 weeks for the ones who were first tested positive to be coming out. So they're only just coming out of that process now, roughly speaking. But it is a piece of information. Again, not only you, a number of us are very keen to understand. As soon as we get it in a format that's acceptable, we will start putting that out there.
Sure. And when do you expect to start getting that information?
Well, essentially, one thing I'm very careful about at this stage is not putting too much extra pressure on the health professionals who are still making sure they've got everything absolutely ready for when the volume of positive cases goes higher than where we are. And don't forget, it's going to start increasing quite swiftly. So over these next few days, I want them to get on with their job of making sure that everything is ready. Once they are happy with that, then I'll obviously be pressurizing them for a little bit more information of that ilk, because we just, at this stage, we focus on them being absolutely ready, caring for the people who are obviously less well, preparing for the ones where there are going to be more who are less well, and obviously then just informing us as to where we are on that profiling wave for any future decisions that we need to make.
Okay, we'll keep on top of that information as well. We've seen some doctors campaigning for members of the public to make their own masks and wear them. Do you support that campaign? Do you advise that people do that?
I don't think it's for me in this stage to advise on it. What I will say is I've seen some observations which make reference to some study that's come out of the Czech Republic, I believe. At this stage, what we do, the only certainty we have at this stage, because I think it's all quite recent on that front, is that for medical purposes, those type of masks wouldn't do the job. Whether they have any use in slowing down larger droplets, in other words, somebody sneezes from behind their own snood or whatever, it's probably not down for me to give support to that or not.
Okay, staying with health issues before we move on to businesses, I have sources in the paramedics team who have told me that they're already seeing rises in attempted suicide. We know that charities across the British Isles and mental health professionals are warning of more deaths from suicide because of this pandemic. What is Jersey's government doing to support islanders' mental health in this time?
That was, you will recall, one of the concerns that we had when we were being asked why we didn't go into lockdown earlier. And that was very much around how do you support those people who either already have mental health issues of any sort of ilk, or actually other people just because of the pressure of either the circumstances they see the island facing, or their own personal circumstances of then being, for want of a better expression, stuck in their flat or their house or whatever it is, depending who it's with as well, and the stresses that places on them. So within the guidelines that we've issued and on the gov.je website, there are some specific things around mental health. It gives contact details, for example, for the listening lounge. And on the helpline, which is the 445566, there are specifically references in there that if somebody does have a problem, give them a call and they can then either advise or get assistance to you. One of the big measures we've been putting in, which is more around vulnerable generally, and that's being rolled out this week, is what we call the community support side of things. We've had a tremendous response of about 2,000 volunteers have registered online to assist. So that is being geared up at the moment. And obviously, I'm not too sure if there's an addition or as part of, but we've also had a fabulous response from within the parishes who have their own support line, support crews, if you like, as well. So there's a whole piece of work being put in place for that, and that will assist not only people who are physically vulnerable, but I'm hoping will give some comfort to people who are finding this difficult in our lives.
Just alluding to what you were talking about earlier with how long you expect the wave to last for, you mentioned a timeline of about 16 weeks. We heard on Sunday the UK's Deputy Chief Medical Officer say that she expects the wave in the UK to last for up to 6 months, and that potentially could be their period of lockdown. What period of lockdown are we looking at in Jersey, do you think?
At this stage, I can't give you a definitive date because we're at the very early stages of the modelling and the profiling, and it depends on what the impact has been of the various measures that we've put in place over the last couple of weeks. So you may recall that when we put the measures in place for the over 65s, which from memory was about 12, 15 days ago, that actually reduced deaths actually in that group by about 35% from memory. And so those measures, in theory, then would start reducing the number of positive tests that we should start seeing. And so it depends how long it takes for those measures to work in through the system, which then impact the profiling. We can see it, and then that will tell us, give an indication of how we're doing. Are we on track to ensure that the health systems, the healthcare providers aren't overwhelmed? And at that point, then you can then start making some decisions around how much longer we need to stay in lockdown or not, or whether you just reduce back slightly, or in worst case scenarios, you actually have to increase matters.
Yeah.
So at this stage, you can't say.
No.
But as I said previously, we're not talking days now. We are talking weeks.
In short, to give our viewers some sense of timeline, do you think it's going to be more or less than 6 months?
As I think I've got to stick to my earlier answer. I can't give that at this stage because it so much depends on how people act within the island, and if we're all responsible as a community, then actually, with luck, we can get through this quicker. But the whole strategy is predicated on ensuring that the health services don't get overwhelmed. We are in early stages of that. We'll only see whether the measures we've taken so far are sufficient over the next few weeks.
OK, let's move on to businesses, because we've seen that only some business sectors in Jersey are eligible for financial support for their employees. The UK government are assisting every company in every sector who have staff. Why, as a relatively wealthy island, is Jersey not doing the same?
I think there's two things within that side. One is, I think the main thing is we do have to keep that balance between making sure we do have sufficient reserves left to come out into the recovery stage, which we are starting to think about. But the second point in all this is not every firm on the island has shut down. So the financial services sector has put a lot of contingency in place, and many of its workers its employees are working from home. They are keeping things moving, which is absolutely fantastic. And therefore, you wouldn't necessarily be subsidising those workers at this stage. But we are going to be looking at it on a bit more of a case-by-case basis. We've done the broad brush approach. What we've now just got to do is fine-tune and see if there's anybody particularly that we've overlooked in the first decision process, and if we do, what level of help we need to give them. So there is an ongoing piece of work happening. I think we'll get more of that over later this week, and that will be to see who we missed and would it be appropriate to give them some help, and what sort of help that might be. Different parts of the economy are requiring and saying they require different levels of help.
Well, one clear group that we've spoken to, many tradesmen, one-man bands, the self-employed islanders seem to be hit very hard. They've got no help at all. They're saying that you need to act quicker and they need help now. What are you doing to help those self-employed people?
Self-employed are covered by the scheme.
In what way? Because I've had questions. Go on.
Unless I've completely misunderstood or there's a lack of clarity in there, my understanding is that the self-employed are certainly covered by the scheme we put in March, and there's every expectation that they would be covered under the one that we put in for April, because we've been acutely aware of those issues. And that will cover the tradesmen that you're talking about.
Well, that's interesting.
What I would say is, if there's any specific comments on that, either feed them up through their trade bodies and then into the group that's being chaired by Senator Farnham, and we'll look at them very rapidly.
What positive reassurance can you give islanders?
We have been planning a lot for this in terms of since COVID-19 kicked off in January. where we are now is we've made decisions that are based on the best medical advice we've got. The community as a whole is rallying, and I would say people in general are acting very responsible in following the directions we put in, and I thank everybody for that. And what I've said in days before now, and what I'm repeating, is I've been so impressed by the community spirit we've seen, and as a community, I believe we can beat this if we work on it together.
This is obviously a huge stress and burden on your shoulders. How are you doing?
I'm doing fine, thank you very much. What I will just say is I've had some great messages of support from various members of either friends, members of the public, and who've occasionally emailed me or what have you, and even occasionally just as I've been walking down the road. And I thank those people for that. It's been very reassuring, and hopefully that will keep coming.
OK, Chief Minister, thanks for your time.
Thank you very much.